you're here because you want to improve your work environment, your knowledge, your understanding. People go into healthcare for all the right reasons. I don't want anything I'm saying today to imply that I don't think the world of healthcare workers or the wonderful people that have saved people in my family. But it is just impossible for even the best people to practice with perfection. That means that an emerging situation down the hall, a nurse goes to get a device or a vial of something, it's not where it's supposed to be. The rounds got messed up because there was an emergency and everything is backed up for an hour. These are human things that happen every day. And they happen all the time. And you may see 20, 30 different caregivers in your hospital bed in any given day, and they'll all change the next day. So how can we possibly get our arms around this problem and help to solve it? The reality is that patients are oftentimes not part of this equation. This quote is from a very famous doctor who teaches at Harvard, Charles Safran. He said this in 2004, that patients are the most underutilized resource in healthcare. One small thing we can do from the whole conversation today is just to ask the question. Just see the response you get if you ask, well, thank you, doctor. Yes, I understand my first colonoscopy, and can I ask you how much that costs? And they're going to say something like, well, let's see what kind of insurance you have. Right? There is no relation between value and cost, because we have been separated from the equation as consumers historically. Once we had to pay for that ourselves, we would be like the Carfax, right? Like Edmunds or the Blue Book. We would research that procedure, the cost, the provider, and we would have ownership of that decision. So just asking that question begins to generate a little conversation, right? When you leave here, just ask, even if they have a laugh. And what if they hear it again from another patient a month from now? That's weird. I had a patient last month that asked that question. You're starting to create the buzz, the stickiness of an idea that we should know how much these things cost. I want to try a little experiment if we can, because I want to show you a little thing you can do to have impact on the whole culture of healthcare. And I need a volunteer. Now I'm the patient. I'm going to keep my feet down.
Hi, Pat. I'm Dr. Bonnie.
Hi, Dr. Bonnie. Good. How are you?
It's nice to meet you.
Oh, nice to meet you too. But you know what? Oh, you don't mind, because I promised my daughter I'd ask everybody to do this. Is that okay?
Oh, that's so smart of you. Thank you so much.
Thank you.
That's so
I
cool.
appreciate it. Thanks.
Ooh, minty.
Do you see? Do you see how
Yeah.
the dynamic is a little different? The idea that we go into medical care at the most vulnerable times of our lives oftentimes might be the last weeks of our lives, and not be treated with the utmost dignity and respect is why I'm doing what I'm doing, and what I know all of you that are motivated by the right things in healthcare care about. It's not just safety. Safety is number one, but it is the privilege we have of bringing that humanity and dignity to people when they most need it. So I have one last slide, because this is my question to you. Who will ensure that safety and compassion and kindness for you when you need it, and for your children when they need it? And that's why we all have a stake in this. And I want to thank you for allowing me to share this with you today.